So I know this channel is called ADHD Doc, but today we're going to talk about something that's completely off topic from what we usually focus on, and that is the COVID-19 vaccine and how we're going to end this pandemic together. And one of my friends expressed her concern and anxiety and frustration for that matter that there's a significant segment of the population who are vaccine reluctant. So up to this point, even though the vaccine is widely available in the United States, so anyone who would like to get one should have gotten one already. So access is no longer an issue. And right now, the hesitancy relies primarily in the lack of trust in the government, in the healthcare industry. And it'll be a hard sell for these people to get vaccinated. So she's just worried that this pandemic will drag on forever. And all of us will be forced to adhere to these intermittent social distancing and sporadic lockdowns for the rest of our lives. But I reassured her that understanding infectious diseases and epidemiology, because I am an author of a vaccine book called Everything Parents Guide to Vaccines, I understand that this is unlikely to be the case. And this is the reason why. In order for the pandemic to stop, the virus have to stop spreading. And in order to stop the spread of the virus, each one of us have to stop being an agent of the COVID-19 virus. So how do we stop being an agent? Which means how do we not unwittingly become a source of transmission for the virus? Well, there are three ways. First way, which is the recommended way, because this is the cost from a cost benefit ratio perspective, this is the one that most scientific sense, is to get vaccinated, of course. I just received the third dose of my COVID-19 vaccine yesterday, and I had relatively few side effects so far. My arms are a bit sore and I'm a little bit achy, but this morning I still ran 4 miles at 4 a.m. in the morning. I call my 4 at 4. Um, I don't think I was any slower than usual, even though afterward I think I feel a little bit more exhausted. But today we're going to spend a whole day catching Pokemon UC Irvine. Uh, so getting vaccinated is the most effective way to maintain a high level of immunity against the virus. Second way is to not get the vaccine, but just catch an infection. Especially now, the Delta variant is so extremely contagious that it's basically just a matter of time that you will catch the virus if you're unvaccinated. And it also seems that those who are less likely to be vaccinated, and many of them are also less likely to take precautionary measures and wear masks. So I think these people are highly likely that catch the virus. So if you catch the virus and recover, you are immune to the virus for some time. Right now, the current estimate is around 6 months or so. And then after that, your immunity start waning and you could catch the infection again. And these people are very likely to catch infection again because they will keep on doing what they're doing, and sooner or later they will get sick the second time. And the second time basically acts as a booster to the immune system. So after the second infection, the immunity is much likely to last for a very prolonged period of time. We don't have scientific data to show how long that duration will be, and it's very likely to vary depending on your age, your underlying immune system, how robust your initial immune response was. If you're sick with the COVID-19 infection the first time and suffered significant symptoms, you're more likely to have a more robust immune response as a result. So if they get the infection over and over again, they're very likely to become immune um, for an extended period of time. And the exact duration is yet to be determined. And what about the third way? Well, the third way is that you get COVID 19 and die. Well, once you're dead, you're not likely to become an agent of the virus because, well, you're probably not having dinner with your Aunt Macy and Uncle Bob at this point if you're dead. So you won't pass the virus on to anyone. The virus will follow you to the grave, literally. So, as you can see, sooner or later, all of human beings on this planet will end up in one of these three situations. And when that time comes, we're all going to be immune or dead. All right, on that happy note, have a wonderful day. Bye bye.